I'm Dr. Jasmine with Savannah Pelvic Health and Wellness. Today, I'm going to walk you through a seated pelvic floor relaxation exercise called the pelvic floor drop. This exercise is a great way to help your pelvic floor muscles fully relax and lengthen. It's really good if you're preparing for labor, if you've been dealing with any pelvic floor tension or pelvic pain, if you're having constipation, or just someone who has difficulty connecting your breath and your core, which is a lot of us. So to get started, you want to grab a small rolled up towel. I'll show you mine. You want it to be firm enough because you want it to give some gentle feedback, but you want it to be soft to sit on. You're going to roll it up and then you're going to place it in at the seat of the chair and you're going to sit on it. From here, you want to sit with your feet planted flat and your spine stacked, so no slouching. You're going to take a slow, deep breath in through your nose, letting your belly, ribs, and pelvic floor all expand gently as you inhale. You want to imagine your sit bones widening and your pelvic floor coming down into the towel. That's all on the inhale. Then on the exhale, you just want to let the air flow out naturally. You don't need to squeeze or tighten anything here. The focus is going to be on letting go and releasing any tension you might be holding. So let's continue that pattern. You're going to breathe in. As you breathe in, you're going to be inhaling down into the towel. That's going to be lengthening your pelvic floor muscles. You're doing a great job. And then as you exhale, you're going to do a relaxed exhale and you're just going to let go. I usually recommend starting with 5 to 10 breaths. You're going to move very slow and intentionally. So it's going to be a really slow inhale and exhale. As you practice, you may begin to notice subtle movement or softening sensations in your pelvic floor, and that is exactly what we are looking for. Over time, this exercise can improve awareness, reduce tension, and help restore balance to your core, and that's super important for your pelvic health. But if you are experiencing any pain or discomfort, stop. Check in with a pelvic floor physical therapist. If you're one of my patients, just stop, wait. When you come in next time or the next time we have a virtual check-in, we'll talk about what we might need to modify. But this is an excellent exercise to do throughout the day. I want you to try it and let me know what you think.